Thank you, John, and thanks so much for the invitation to present today. So this little green one is the forward. Yeah, hope for the best. No, the one I shouldn't miss. Okay. So I'm going to talk today about cancer prevention, and I don't have much time to do it. So what I thought I would do is focus mostly on tobacco control. And that's because, as you can see in this slide, it accounts for a hell of a lot of cancer cases and cancer deaths. So this is some research led by David Whiteman from the Queensland Institute for Medical Research. And he led a team that calculated the population attributable fractions of cancer due to 20 modifiable or preventable causes, using recent data on exposure prevalence and relative risks. And you can see in the blue, of all cancer deaths, a total of 38% are attributable in total to preventable causes, and a total of 33% of cancer cases in the pink are preventable in relation to those causes. And you can see that the greatest contribution to both outcomes, as I said, was tobacco, accounting for fully 23% of cancer deaths and 13% of new cancer cases. The other causes were dietary factors, overweight and obesity, infections, as we've heard, sun exposure, alcohol, insufficient activity, and hormones. And there's a story, I suppose, of the science of cancer prevention in how population change in all these risk factors has been achieved so far or has begun in earnest. It's no accident, though, that we've seen most change in the risk factors that we have intervened with at the most at the population level, and those two are tobacco control and skin cancer prevention. So in my 10 minutes, I'm going to focus on the largest one, which is tobacco. So in 2003, the World Health Organization launched the world's first public health treaty, the Framework Convention on Tobacco Control, or the FCTC. And the FCTC recognises that there's no silver bullet for population interventions in a risk factor like this. The FCTC requires countries to pursue a range of evidence-based interventions that work in a kind of complementary fashion to reduce smoking prevalence. Measures to reduce the purchase cost of tobacco are absolutely critical, though. They have the largest effect on reducing population smoking prevalence. And it's especially important for reducing smoking among the most price-sensitive groups, and that includes younger people and those of lower socio-economic status. The FCTC also requires countries to pursue a range of regulatory interventions, and examples of these are guidelines for severely limiting tobacco marketing. And that's important because tobacco marketing is a causal factor in youth smoking uptake. There's really strong evidence for that. Australia, I'm pleased to say, has been at the forefront of that, with removing advertising from all forms of traditional media, from sponsorship at the point of sale, and finally from tobacco packaging with its world first plain packaging law in 2012. The Framework Convention on Tobacco Control also requires countries to limit smoking in public places, and we've obviously made very good progress with that, as well as with large graphic package health warnings as well in Australia. Also, countries are expected to conduct mass reach multimedia campaigns to warn of the harms of smoking. We've done well in that respect. And to direct smokers to sources of help to quit, and also to provide accessible smoking cessation advice and support. So economic and regulatory approaches are absolutely critical to achieving population change in health behaviours like smoking, as well as other behaviours like dietary change or reducing alcohol consumption. And this is because there are many things in our environment that work against sustaining individual behaviour change. Early in the course of our tobacco epidemic, tobacco marketing was pervasive. Cigarettes were readily affordable. You could smoke pretty much anywhere. Social norms promoted and even celebrated use. Education about the harms of smoking were lacking. and one was left completely to one's own resources to quit this highly addictive behaviour. Getting in place some of the taxation and regulatory interventions changed the environment for the better, and together with our hard-hitting mass media campaigns, it's greatly changed social norms for tobacco use here in Australia. This means it's a much more supportive environment for young people in Australia to avoid taking up smoking, and we've seen dramatic change over time in smoking rates among secondary school students. Declines have occurred in both younger and older secondary school students since the late 1990s, and we've been coordinating these surveys every 3 years of Australian secondary school students since the 1980s. In 2017, smoking was the lowest ever recorded, with only 5% of 12 to 17-year-olds having smoked in the last week. And adult smoking prevalence in Australia has also declined considerably over time, as shown in the blue line here. And you can see examples of the kind of population-level interventions that have achieved this over the last few decades: taxation, regulation, and large-scale media campaigns. This slide shows prevalence as recorded by our government triennial population surveys. And this is data from a monthly population survey of adults undertaken by the Roy Morgan Company, which also shows this downward trend. And at the Cancer Council, we used this monthly survey data to undertake interrupted time series analysis to assess the impact on smoking prevalence of several very large tobacco tax increases in Australia. And in fact, Australia is one of the first countries in the world to increase taxes on this kind of scale. So the black line on this graph shows the fitted trend of what actually happened after each large tobacco tax intervention that Australia had. And you can see that in 2010, a 25% tobacco tax increase caused a rapid decline in prevalence, quite different from the counterfactual that you can see there in red. But over the few years following, smokers relapsed gradually back to smoking in the period thereafter, and that was due to some very aggressive tobacco industry price discounting. Then the next tax intervention, beginning in December 2013, caused another big drop in prevalence. And this was the start of a series of annual tax increases of 12.5% per year. And this decline in prevalence has been more sustained. And it's due to the fact that the tax increases happen every year and the tobacco industry just couldn't fight back against that. We found it's been especially important for reducing smoking prevalence in lower socioeconomic smokers. So that's really important for us. There are challenges going forward, and the first is that the idea that tobacco control is done and dusted, and it's just a set and forget, and we don't need to keep worrying about it. We've got a low enough smoking prevalence, and that's good enough. Well, that would be a big mistake for us. We know that prevalence is not going to keep falling on its own. We know that when we take our foot off the pedal in terms of policy implementation, prevalence plateaus and rises again, especially in school students. So let me give you a sense of what this country is still up against. The tobacco industry has relentlessly pursued new types of reassurance marketing, and these are product modifications designed to distract consumers from the serious harms of smoking or to underestimate the harms of smoking. Often they're product engineering gimmicks to make tobacco seem more palatable and less harsh. And some of these result in smokers inhaling more deeply, potentially increasing the risks of some diseases. And I'll give you just two examples among many. The one example that I've used here that distracts from the harms and increases curiosity to try is the emergence of crushable capsules in cigarette filters that can release a burst of menthol flavour. And these increase palatability and are highly attractive to young people. In 2017, 5% of all Victorian school students had ever tried these, which is a huge number. It is possible for us to ban these, and this has already been done in other countries, and we'd like to see some movement on this front. Another example is increased promotion of roll-your-own tobacco. Roll-your-own tobacco is priced more cheaply and it seems to smokers to taste and look more natural. But unbeknownst to them, it contains more additives and humectants to keep the tobacco moist. And these humectants produce acrolein, and when they burn, this increases the risk of serious heart damage. It is possible to harmonise the tax on roll-your-own tobacco with ready-made cigarettes to make roll-your-own tobacco less expensive to buy, and we need to do more as well to warn roll-your-own smokers of the harms. There's much more to be done to increase and standardise the purchase price of tobacco. And of course, there are challenges in relation to mass media. It's critical to communicate new evidence on harms to smokers, because these new harms come out in the epidemiological literature all the time. We need to reach and engage smokers more effectively, and that's difficult given changes in our patterns of media use. It's more expensive to run large-scale media campaigns now than it used to be to achieve adequate reach. And government hasn't continued to fund these campaigns at evidence-based levels, so we need more action on that front. Providing improved access to smoking cessation advice and support is also critical in a high taxing environment, and integrating the promotion of quitting help with mass media campaigns so smokers can be directed to sources of assistance to quit. And finally, the emergence of e-cigarettes and other forms of heat-not-burn tobacco products is really challenging. They are very aggressively being pushed by the tobacco industry, and Philip Morris is around the country at the moment doing a full court press on state and federal governments to have these products made more available. E-cigarettes containing nicotine are currently banned under Australia's poisons laws. The National Health and Medical Research Council and other major groups view the evidence for their use for achieving smoking cessation as extremely weak. E-cigarettes are highly attractive to youth though. They pique the curiosity of non-smokers, and that's a big problem for Australia, where we've achieved such low smoking rates among adolescents. Australia's smoking prevalence continues to fall due to a comprehensive tobacco control approach. So the case for introducing e-cigarettes, in fact, is not strong. So the story of tobacco control in Australia has many of the elements shared by other areas of cancer prevention, where the aim is to change behaviour at the population level. And you can see in my illustration from tobacco that a key theme is the use of multiple complementary strategies in combination: taxation, different types of regulation, and large-scale education, used over time to change the environment so that it supports healthier behaviours. It's unrealistic to expect a single intervention to accomplish huge change that can be sustained over time. It's definitely not a set and forget problem. And also important, just finishing up, is the use of some solid monitoring systems and surveys to evaluate impacts at the population level, so we can tell what is working and identify target audiences for the future. Thank you.